Hey, welcome! Today we're going to put on our detective hats and try to solve a real medical mystery. We're diving into a condition that can hide in plain sight, causing this incredibly frustrating high blood pressure that, well, it just won't seem to go down no matter what you throw at it.
I mean, this is a question that drives both patients and doctors absolutely crazy, right? You're trying different medications, you're changing your diet, you're exercising, but those numbers, they just stay stubbornly high. It feels like you're fighting a ghost. But what if the real problem isn't what you think it is at all? And this gets right to the heart of what we're talking about today. What if the issue isn't a system-wide thing? What if it's a very specific clog in the pipes leading to one of the body's most critical organs, your kidneys?
So this plumbing problem actually has a name: renovascular hypertension. It's a major, and here's the really important part, a reversible cause of high blood pressure. And if we can understand it, we can finally crack the case of why that stubborn BP just refuses to cooperate.
Okay, so here's the key thing to get. This isn't what we call primary hypertension, the kind that sort of develops on its own over many years. This is a secondary form. That means it's being caused by another very specific issue. The kidneys just aren't getting enough blood flow, so they get tricked. They think the body's overall pressure is dangerously low, and they sound this massive false alarm that sends pressure soaring everywhere else.
Right, so every good mystery has its culprits, and in this case, there are two main suspects that are responsible for narrowing those vital arteries that lead to the kidneys. Let's unmask them.
Now, as you can see, one of these suspects is way more common than the other. Atherosclerosis, that hardening of the arteries we always hear about, that accounts for the vast majority of cases. But that other, smaller cause, fibromuscular dysplasia, represents a really different and important piece of this whole puzzle.
And what's so fascinating is just how different the profiles of these two causes are. You've got atherosclerosis, the usual suspect. This typically affects older patients, people with risk factors like smoking or diabetes. But then you have fibromuscular dysplasia, or FMD. That's the unusual suspect. It's way more common in younger women, and it creates this really unique string of beads look in the artery that has absolutely nothing to do with plaque buildup.
So we've got our suspects. Now let's figure out the crime itself. How in the world does one narrowed little artery convince the entire body to crank up the pressure to these dangerous levels? Well, it turns out it's all about a wild chemical chain reaction.
Let's walk through this domino effect, because it's pretty incredible. First, the artery narrows. The kidney, sensing this, totally panics and shoots out a hormone called renin. Think of renin as the starting pistol for a race. It kicks off a chain reaction that creates this super powerful substance called angiotensin II. Now this stuff is the real alarm bell. It does two big things at once. It squeezes blood vessels tight all over your body, and it tells your glands to release another hormone, aldosterone. Finally, aldosterone makes your body hang on to salt and water. So tighter pipes plus more fluid, you guessed it, that equals skyrocketing blood pressure.
Okay, so now that we get the mechanism behind the crime, how do doctors actually figure this out? Well, like any good detective, they don't just look for one thing. They're looking for a specific pattern of clues that all point to this specific plumbing issue, not just general high blood pressure.
So what are these telltale signs? What are the red flags that make a physician pause and think, wait a minute, maybe we should be looking at the kidneys here?
This is basically the detective's checklist. And remember, no single clue solves the case, but when you see a pattern emerge, that's when you know something's up. The biggest red flag is what's called resistant hypertension. That's when even 3 or more different drugs can't get the blood pressure down. Doctors also look for a sudden spike in blood pressure in people who are either pretty young or a bit older. But maybe the most telling clue of all is when a patient's kidney function suddenly tanks right after they start a very common blood pressure pill called an ACE inhibitor. That's a huge, huge signal to look closer at those kidney arteries.
So once that suspicion is high, doctors open up their diagnostic toolkit. They'll usually start with something non-invasive, like a Doppler ultrasound, which basically lets them listen to the blood flow. To get a better picture, they might move on to a CT or MR angiogram, which creates this amazing 3D map of the blood vessels. But the definitive, gold standard test is a renal angiography. That's where they can go in with a catheter and see the blockages directly, in real time. No more guessing.
Okay, the case is officially cracked. We've identified our culprit, we've confirmed the blockage. So what's the plan? How do we solve this? Well, the strategy is basically a two-pronged attack to finally get that blood pressure under control for good.
And when it comes to treatment, the goals are actually pretty straightforward. It's not just about lowering a number on a screen. The real point is to control the pressure, sure, but also to protect the kidneys from any more damage and, this is the big one, to prevent major events down the road like a heart attack or a stroke.
So the first line of attack is medication, and the goal here is to disrupt that false alarm system we were just talking about. The most targeted drugs for this are AC inhibitors and ARBs, because they directly block that whole RAS cascade. They can be incredibly effective, especially when only one kidney artery is blocked. The other meds are kind of like the supporting cast. Calcium channel blockers help relax the blood vessels in general, and diuretics help the body get rid of all that extra fluid it's been holding on.
But, sometimes medication just isn't enough. In those cases, you might need an intervention, like an angioplasty, where they go in and physically open the artery with a tiny balloon. But this is usually reserved for very specific situations. We're talking about medical emergencies, like flash pulmonary edema. That's when the pressure gets so high that it suddenly forces fluid into the lungs, or when the blood pressure just stays dangerously high no matter how many meds you're on.
So, who gets the best results from these interventions? Well, the evidence is pretty clear. Younger patients, and especially those with fibromuscular dysplasia, our unusual suspect from earlier, they often see a massive improvement. Sometimes it's even a complete cure. It's just a perfect example of why treatment has to be personalized to whatever is actually causing the problem.
And that brings us right back to where we started. For that person with frustrating, stubborn, resistant high blood pressure, the answer might not be trying yet another pill or a different diet. The answer might just be hidden in the plumbing, just waiting for a detective to find it. It's a pretty powerful reminder that sometimes, to solve a really big problem, you have to look for a very, very specific cause.